evening. Thank you for joining the Healthy for the Holidays COVID-19 Vaccine Town Hall. I'm Dr. Monica Taylor, Vice Chair of Delaware County Council. Delaware County Council and the Delaware County COVID Task Force have organized this town hall to help ensure that residents have the latest COVID-19 information as we move into the holiday season and residents gather with loved ones and travel. The CDC and the Pennsylvania Department of Health are tracking worrisome trends related to COVID-19, positivity rates, and hospitalizations. We saw a rise in cases after Thanksgiving holiday, and we expect to see a continued rise in cases due to colder weather and the possible impact of emerging variants, creating further concern. With these trends in mind, we remind residents that vaccines remain the best defense. COVID-19 vaccines are effective in protecting people from getting sick, significantly lowers the severity of the illness, emergency room visits, hospitalizations, and deaths among those who have a breakthrough infection. According to the most recent CDC and PADOH data, unvaccinated people are 6 times more likely to suffer from severe illness, 9 times more likely to require hospitalization, and 14 times more likely to pass away from COVID-19 complications versus those who are vaccinated. Additionally, hundreds of millions of doses of COVID-19 vaccine have been administered safely with few adverse reactions reported. Tonight, we have a panel of distinguished health experts who will discuss the latest data regarding regional COVID-19 positivity rates and hospitalizations, boosters, variants, vaccine hesitancy, and more. The Healthy for the Holidays COVID-19 Vaccination Town Hall panelists include Dr. Victor Ruan, epidemiologist for the Delaware County Health Department, Dr. Lisa O'Mahony, pediatrician and Delaware County Interim Physician Advisor, Dr. Patrick J. Brennan, Chief Medical Officer and Senior Vice President of University of Pennsylvania Health System and Delaware County Board of Health member, Dr. Maria Barrett, Associate Professor, Widener University Center for Social Work Education. Each panelist will present for a 5 to 7 minute period. After each panelist has presented, we'll open up to questions and answer portion of the town hall. Residents can submit questions using the chat feature if they are watching the Zoom presentation on a device or by pressing 0 to submit the question by phone. Questions will be read by the county's Public Relations Office and answered by the panelists. You can begin submitting questions now and can submit them throughout the presentation. We hope this town hall provides answers to your questions and useful information. Let's begin. We'll begin with Dr. Victor Elos Ruan, epidemiologist for Delaware County.
Good evening. It's a pleasure and an honor to be with you. And I would like to share some numbers about COVID-19 in Delaware County. I would like to also describe that the numbers that we're going to use will tell us a little bit about the health of the community. Very similar to when one goes to a physical checkup with the doctor's office, you get your blood pressure, you get your pulse, your weight and height. We use numbers to make an assessment about the health of an individual, as well as making numbers, the one that we're talking today, to make an assessment of the health of our community and COVID. So before I provide, I would like to share that as we have seen numbers of new cases, numbers of individuals visiting the hospitals because of COVID, hospitalizations, emergency department visits, and numbers of individuals with COVID needing ventilators. All of these numbers indicators are increasing. For example, we have seen that if we look at the number of cases on ventilators, When we compare the numbers from the last 14 days, we have seen a significant increase in our county, as well as our neighbors. I would like to also talk a little bit about the vaccinations in Delaware County. And what we have here is a comparison between Pennsylvania and Delaware County. Specifically, we're going to look at the percentage of individuals that are fully vaccinated, 2 doses, the recommended doses of the recommended vaccines. We're going to compare that across the state, all the counties, and then our county. For example, for Delaware County, as of December 2nd, 59.8%, almost 60% of individuals were fully vaccinated. Now, compare that with Pennsylvania, which slightly smaller amount, 57%. So we have a slight edge in the numbers of fully vaccinated individuals in Delaware County. When we look at the percentage of fully vaccinated by race and ethnicity, there are some differences between Delaware County and Pennsylvania. For example, our African-American residents are less likely to be fully vaccinated when compared with African-American residents in the state. Similarly, for Asian Pacific Islanders and for Latinos or Hispanic individuals. Now, when we look at the number of individuals actually vaccinated, when we look at it by age, we see a healthy number in the age group of between 15 and 19. So that tells us that parents are actually getting their children vaccinated. Let me talk about another number that we use to measure the health of the county regarding COVID. That is called percent positivity. The percent of positive tests divided by the total tests in a percentage. We're looking for something below 5, ideally less than 3%. Right now, we are at 9.8, has gone up. It went up from 5% of October 22nd to December 2nd, 9.8. Now, what is this number telling us? It tells us that there's a higher risk of transmission of the virus in the community as the number goes up. So that is a number that we use to measure the transmission. There's another number too that we also use to measure transmission. It's called rate, incidence rate. Incidence rate is actually the way to measure the new cases of any disease, in this case for COVID. And what it tells us is the risk of getting infected by COVID. And we're looking at higher incidence rates from 139.6 to 160, so an increase. And it's telling us that the number of individuals getting infected is higher, and we calculate that by population standards, we get the rate. Now, what are we seeing? Look here, increasing trends in these indices tells that the risk of getting infected is higher. And we are concerned about that, and we would like our communities to protect themselves, family members and everything. And the way that we can protect themselves is with vaccination, masking, social distancing. Now, let's talk about hospitalizations and ventilators also going up. So why is this happening? A lot of more susceptible individuals getting infected by the virus, mostly unvaccinated individuals. The other possibility is that the immunity is declining, and that's why we will need boosters. And also, we might find individuals with higher risk of getting infected by COVID, individuals with problems like diabetes, some type of heart disease, and obesity. Now, I would like to also talk a little bit about what we can do to to protect ourselves. And if we look at the increasing number of cases, then why is that? Because unvaccinated is the major source. And of course, when we get the season, the cold weather, people are gathering inside facilities and homes. And that's why it's more transmission is taking place. Likewise, we're also recommending that everyone take care of themselves, vaccinations, social distancing, and masking. And I would like to finish with a brief message to our Spanish-speaking friends. With your permission, I would like to say that todos nuestros amigos en el municipio de Delaware, por favor, si tienen alguna pregunta, nos pueden llamar al 484-276-2100. Muchas gracias. Thank you very much, and we're happy to entertain questions at this time after the other members of the panels finish their presentation.
Okay. Thank you, Dr. Ilsron. Our next presenter is Dr. Lisa O'Mahony, a pediatrician and Delaware County's interim physician advisor. Dr. O'Mahony.
Thank you, Dr. Taylor, and thank you for this opportunity to share information about COVID-19 in children. It is difficult for all of us to believe that it has been nearly 21 months since the start of the pandemic. Families with school-aged children have been especially impacted with the stress of remote learning, disruption of sports and extracurricular activities, and the associated physical, mental, and emotional burdens that developed in our kids. According to the American Academy of Pediatrics, as of December 2nd, over 7 million children have tested positive for COVID-19. As we speak, COVID cases among children are extremely high. Over 133,000 child cases were added this past week. For the 17th week in a row, COVID-19 cases are above 100,000. As of the first week of September, there have been nearly 2 million additional cases in children in the United States. Available Delaware County COVID-19 data for cases in the 0 to 4 age group totals over 500 cases, and for kids 5 to 18, the cases total over 2,500. But these numbers are likely gross underestimates because the full picture would represent all cases, and so many children have asymptomatic cases. Many of these kids are never tested. According to the CDC, weekly COVID-19 associated hospitalizations rose nearly 5-fold in children during late June to August. This coincided with the Delta variant surge. Hospitalization rates were 10 times higher among unvaccinated than among fully vaccinated adolescents. While COVID-19 is often a mild disease in children, since the beginning of the pandemic, among US children ages 5 to 11, cases have totaled over 1.9 million, with over 8,300 hospitalizations and at least 94 COVID-related pediatric deaths. Approximately 1/3 of hospitalized children ages 5 to 11 require ICU admission. Minority children are more likely to be hospitalized due to COVID-19. More Native American, Alaska Native, African American, and Hispanic children ages 5 to 11 required hospitalization from March 2020 to October 2021. Complications from COVID-19 in children have been recognized since the beginning of the pandemic. Multi-system inflammatory syndrome, a condition where different body parts become inflamed, including the heart, lungs, brain, eyes, skin, and GI organs, has been reported in over 5,000 children. 44% of these cases in children 5 to 11 years of age. Like adults, children with underlying conditions such as asthma, diabetes, sickle cell disease, or immunosuppression are also at increased risks for severe illness with COVID-19. Post-COVID conditions also occur in children. It is estimated that 7 to 8% of children with COVID-19 reported continued symptoms of headache, fatigue, trouble concentrating, muscle and joint pain more than 12 weeks after their diagnosis. The Pfizer pediatric formulation is safe and effective. Clinical trials of more than 4,600 children in the 5 to 11-year-old age group found that the vaccine was 91% effective. Side effects were mild and lasted 1 to 2 days. No cases of myocarditis were reported in this age group. The pediatric dose is 10 micrograms. That is 1/3 the dose used for the 12 and over population. So benefits of vaccine in the pediatric age group will translate to prevention of hospitalizations, multi-system inflammatory syndrome, post-COVID conditions, and death. Further benefits will mean prevention of transmission to vulnerable family members. Vaccinated children will add stability and predictability for working parents, and of course, lower transmission in our schools, adding more confidence in in-person learning. We are all looking forward to the end of this pandemic. Vaccination remains the most powerful tool to get there. Thank you for your time and attention. I am always available for questions.
Thank you, Dr. L. Up next, we have Dr. Patrick J. Brennan, Chief Medical Officer and Senior Vice President of the University of Pennsylvania Health System, and our Delaware County Board of Health member. Dr. Brennan.
Thank you, Dr. Taylor. What we're seeing right now in the region, based on the most recent viral sequencing from isolates all over the region, is that most of the viral isolates are the Delta variant, which is very easily transmissible. It's probably 3 times as transmissible as the original strains of the virus that circulated last year, and more transmissible than the influenza virus that's circulating right now. We have had Omicron in the region, and I expect we'll see more. There is the potential that it will crowd out the Delta strain, just as Delta crowded out earlier lineages of the virus. Delta appeared in this region in the May-June timeframe, and by July was the dominant strain, and by the fall had crowded out all the others. It appears that what's happening in it appears actually that that's what's happening in South Africa, that it has crowded out other strains of the virus. Omicron may have first occurred in a person with a compromised immune system. We don't know for sure where it actually occurred, where it got its start, but it has swept up many of the earlier mutations seen in different lineages of the virus and then created about 30 new ones of its own. It probably happened because an infected patient whose immune system was unable to bring the infection under control and eliminate the virus from their system sustained replication or reproduction of the virus over and over and over again. Coronaviruses make a lot of mistakes as they replicate, and those mistakes become the mutations. So the longer it replicates and the more it spreads, the greater the chance for mutation, new variants, and the potential for loss of protection from antibodies and vaccines. So the sooner we can bring this under control, the sooner we can stop the creation of new variants. I want to talk a little bit about the continued need to be vaccinated. As we've heard, in Delaware County, we've had much greater success with the vaccination campaign than many other areas of the Commonwealth and the nation, but we still have a long way to go. More than 90% of those over the age of 65 have received 2 doses. Younger age groups have not been as accepting of the vaccine. And of course, it has only become recently available for 5 to 11-year-olds. So why get vaccinated? Well, as you've heard, it prevents the serious consequences of infection with SARS-CoV-2, the virus that causes COVID-19. When the vaccines were first in clinical trials in the spring and summer of 2020, the hope was that they would prevent serious illness and death. Those were the outcomes we were most interested in. We hoped they would also prevent infection. We can say with certainty that they're doing their job. Since July, about 75 to 80% of the patients admitted to our hospitals in the Penn Medicine system have been vaccinated. 75 to 80% of the patients admitted to our hospitals have been unvaccinated. 75 to 80% have been unvaccinated. So 20 to 25% are previously vaccinated individuals. This has been very consistent, and it tells us that the vaccine is working. Some people with compromised immune systems will not mount an effective response. Those who do get sick but have been vaccinated have less severe disease and recover more often than those who are unvaccinated. Why get a booster? Well, after a year of experience with the COVID vaccines, we know that antibody levels do fall over time. That happens with most vaccines. Vaccines against tetanus, diphtheria, mumps, measles, and rubella all require multiple doses of the vaccine to achieve and sustain immunity. Those who were vaccinated a year ago have been protected. What we don't know yet is the level of antibody in our systems that is necessary to neutralize the virus. So out of an abundance of caution and knowing that the vaccines have proven to be safe as well as effective, a third or booster dose has been recommended. The third or booster shot has been recommended to achieve still higher levels of antibodies. We still have a lot to learn about the vaccines and how often they will have to be administered. It may be that the full course of vaccination will require 3 doses, and that may sustain us for a long time. We will learn more in the next year about the need for future boosters, whether they need to be adapted to future variants or whether the third shot will be sufficient. It was just reported today that the third dose of the Pfizer-BioNTech vaccine provides greater protection against the Omicron variant than just 2 doses. That is, people who have been boosted have better protection. Despite the increase in viral transmission in the community, there is a bit of good news. With each subsequent wave of the pandemic, fewer people have died. But it becomes a simple math problem. With widespread transmission, even if mortality is 1% or less, if you have an easily transmittable mutant strain and more people get infected, then 1% of 1 million people results in many more deaths than 1% of 100,000 people. So it's our hope that we will be able to continue to promote vaccination in the interest of personal health, reducing the most severe consequences of disease, but also public health to prevent the creation of new variants and the spread of more easily transmissible strains of the virus. Thank you.
Thank you, Dr. Brennan. And now I would like to move on to our fourth and final panelist, Dr. Maria Barnett, Associate Professor, Widener University, Center for Social Work Education. Dr. Barnett.
Hi, thank you so much, Dr. Taylor. Thank you, everyone. It's a pleasure to be here. It's really interesting, right? And so there's nothing new about any of this. We've been dealing with this for 225 years, folks, 225 years of vaccinating individuals in the world, right? Since 1796 with the smallpox vaccine. And so we've been down this road many times before. For every vaccine, there's been a campaign against it. And so think about in the case of polio in 1954 and how many people were hesitant about getting their children vaccinated when the United States decided that they were going to require vaccines for every child, right? Here's the reality. Vaccine hesitancy has less to do with misunderstanding the science and more to do with general mistrust of scientific institutions and government. And so what I'd like to do is to shift the conversation a little bit from vaccine hesitancy to vaccine confidence, because it's very difficult to convince communities that vaccines are important at a time when the government hasn't acted in their best interest at other times. And so that hesitancy that people have has been earned in many regards by the medical and scientific community. It's been very difficult to get real answers about what's happening in the United States. The media on a daily basis is giving misinformation, cross-information, no information. And so we can understand why people are confused. So what we've been doing in the city of Chester is we've been trying to flip the script a little bit, away from hesitancy to vaccine confidence, and helping people to sit down and have conversations about why this is important. So what we believe is that a successful vaccine campaign has to address the issues of trust between those giving the vaccines and those receiving it. And since it's rooted in many different factors, it's important to identify where it stems from before working through how to overcome it. The most successful approaches that we've had in building trust and open communication is helping people to reflect on why they are hesitant, helping them to get to their doctor. Here's the thing. This person you have trusted to help you birth your children, to take care of your grandmother, to take care of you. You've trusted your pharmacist for every medicine that you've needed. And so what we're asking you to do is we're asking you to sit down with those people and have conversations with them. If you are hesitant, if you have any fears, if you have any misgivings, talk to the people that you have trusted your whole life. And so what we want to do, professionals, is we want to help people to face their anxiety. We want to make sure that they have access to credible information. Facebook is no place to learn about the best place to get information for a vaccine and any kind of social media. These aren't people who know you. These aren't people that have any connection to you or care about you in any particular way. And so we want to help people to get to credible information. And we want to provide opportunities for people to discuss their concerns with trusted professionals. And so that might mean acting a little differently. It might mean having office hours available where people can just call in. And I think Delaware County has a hotline like that where people can just call in and ask questions that they need to ask. We want to help people tap into kind of a deeper motivation for what their reasons are for not wanting to be vaccinated, but also why should you be vaccinated? So I'll share a story with you. So I got COVID. And I didn't get COVID because I was messing around. I wasn't partying. I was scared to death. I was in my house, had my kids sequestered in the house. Nobody was out, but my husband's a doctor. And unfortunately, a lot of people didn't make good decisions when they went to see their doctor. They didn't let them know ahead of time. They gave misinformation often and showed up without masks. My husband got COVID and he came home and he gave COVID. I got COVID after that. I don't want to say he gave it to me because that sounds terrible. But I did get COVID and I almost died. I looked in my kids' eyes and I saw the fear that they had about not just losing one parent, but the possibility of simultaneously losing both parents. This was before the vaccine was available. So when the vaccine became available, it was very interesting. My son, who is 16, he was ready to go. He was ready to sign up for any possible, if there was a trial out there, he was going to sign up for it. And he actually said to me, Mom, I really think you need to get the vaccine. I was kind of nervous myself, but I got the vaccine and both of my children are vaccinated. And yes, it hurt for 5 minutes. Yes, I had a couple of minor symptoms after getting the vaccine. Minor, little stuff, right? You have pain in your arm, but that goes away. You might get a headache, but that goes away. But I can tell you, there's nothing from that shot that was like what I had to deal with when I had COVID and I couldn't breathe. And guess what? If you think that just getting COVID is okay, well, I'll get it, it'll go away. No, folks. It's been a year since I had COVID and I lost hearing in my left ear just a month ago. No reason. But about 15% of people who get COVID lose their hearing. And there are other side effects that happen as a result of it. I don't want you to experience that. I don't want anybody to experience that. And what we're finding, as you've heard from these amazing professionals, is that those people who get the vaccine don't experience those kinds of long-term effects. I couldn't get the vaccine. It wasn't available when I got COVID. But I certainly would recommend that anyone out there who hasn't gotten it, for the sake of you, for your families, for your children, for your friends and loved ones, that you get the vaccine. So if you're trying to encourage someone to get the vaccine, here's what I would say. Don't yell, don't argue, just listen. Help them to clearly articulate what their fears are, and then do everything that you can do to allay those fears by getting them to the information sources that they need. Share the reasons why you chose to get the vaccine. What we're finding is that when people sit down one-to-one and have good conversations about why it's important, not, it's important for society or all of these other things, but man, I love you and I want to make sure you're safe. When we do that, we're much more successful. People feel heard, and they don't feel as though someone is coming down on them and making them do something that they don't want to do. So just have conversations with your loved ones. Thank you for this opportunity to speak to you. Thank you for this opportunity to be with such a distinguished panel. And I'm happy to take any questions that you might have.
Thank you, Dr. Barnett, for sharing your story. We appreciate your candor. And thank you to all of our panelists this evening. Your experiences, background, and extensive knowledge are extremely valuable. The pandemic has caused fear and uncertainty for most of us, and understanding the data and how the vaccines work is critical. Your presentations addressed some of the key facts and also cleared up some of the misconceptions that are out there. We invited residents to submit questions to our panelists, and you can submit questions using the chat feature if you are watching the Zoom presentation on a device, or by pressing 0 to submit the question by phone. Senior Communications Specialist Ryan Herlinger will be reading questions submitted through the chat feature and by phone. Panelists, please jump in if the question pertains to you. If a panelist has already answered and another panelist feels they can add additional information, please jump in as well. Let's begin with our questions. Ryan?
Okay, our first question is from Angela in Brookhaven. Angela's question is about blood clots and, quote, how the COVID vaccines impact them.
I'm sorry, I couldn't hear the end of the question, Ryan.
Sure, I'll repeat that. So the question is a pretty simple one. Really, it's just about blood clots, and what Angela wrote was how the COVID vaccines impact them.
Well, I'll take a stab at that. Early on in the pandemic, we saw lots of patients. In fact, a good friend of mine who had COVID and was a surgeon had a stroke during the course of the acute phase of COVID. It will prevent those things from happening, frankly. It prevents the most severe complications of the consequences of COVID, and many people will be prevented from getting infection. So now there may also be questions about the vaccines themselves and causing blood clots. Those are rare events. We know much more about them and how to avoid them and how to treat them, and so. I think that's less of a consequence than it was when they were first discovered. But the vaccines can prevent the consequences of the serious outcomes of COVID.
Thank you, Dr. Brennan. And I just wanted to add one thing, not to the question, but just kind of technical wise. For those of you who are submitting questions on Zoom, can you please submit them via the Q&A section, not the comments? Thank you. Go ahead, Ryan, you can read the next question.
Sandra writes, do you recommend switching vaccines when you get your booster? Would switching from Moderna to Pfizer give better coverage against Omicron?
Lisa, do you want to?
Sure. What is recommended is probably to stay with the vaccine that you started with. So if you initially got immunized with Moderna, stay with Moderna. Pfizer, stay with Pfizer. You've done well with those. And if you've had J&J, often people are boosting with a Pfizer or Moderna, but you can also boost with J&J. And I think the point that this makes, that you can mix and match, is that you get a really robust antibody response with these boosters, no matter what you get. It does appear that maybe Moderna and Pfizer might boost a little higher than J&J, but all of them, even J&J, will boost you to a point where you will be well protected.
As I said in my remarks, it was just reported today that a third dose of Pfizer is more protective against Omicron than just 2 doses. So, there's good benefit there.
Next question. Our next question is from Kathleen. Are there statistics on the number of hospitalizations and the number of individuals on ventilators in Delaware County, either daily or over the last 7 days? There's a second part. Also, has Omicron entered Delaware County? Considering its mutative ability, is there a higher level for concern about this strain? Should the public treat Omicron differently than past strains?
Hi. Yes, this is Victor. I would like to address the first question. There are statistics on a daily basis updated by the Pennsylvania Department of Health on the number of patients on ventilators. Recent data, they track that by day, but we have access to numbers by month, and we can compare that to what happened last year. And like we mentioned earlier, the most recent trend indicates an increasing number of patients with COVID on ventilators in Delaware County. So unfortunately, that is happening. It was not happening a few weeks ago, maybe 28 days ago, but it is currently happening.
Okay. Ryan, could you read the second part of the question again?
Sure. So the second part, Kathleen wrote, has Omicron entered Delaware County? And considering its mutative ability, is there a higher level for concern about this strain? And should the public treat this strain differently?
I'll take a stab at that. I'm not aware of any identified cases in Delaware County, but I expect they're here. I mean, I'm not trying to be alarmist, but we've identified one in the region, and given its transmissibility, I think, it's currently been identified in 19 states. It takes a while for sequencing to be done. I think when the next batch of sequences come out, we'll find that there's a greater proportion of the SARS-CoV-2 viruses in the region that are Omicron. That's what I'm expecting. At least some of them may be in Delaware County. I expect that it will come here. Should we be more concerned? There's a lot we still don't know. The anecdotal reports so far suggest that while it's more easily transmissible, it may not be more virulent. But time will tell. And as I said earlier, the more people get sick, there'll be more deaths. 1% of a bigger number is more deaths. So I think the things that we've done to date, the mitigation practices, distancing, hand hygiene, masking, are all still very important given the degree of transmission in the community, and emphasizing getting fully vaccinated and then getting boosted.
Thank you, Dr. Brennan, for your response. And just a reminder for those of you on the phone, I know there are quite a few of you out there. If you have a question, please hit 0 on your phone in order to ask a question. Ryan?
Okay, our next question is from Tracy. And Tracy asks, is it safe for vaccinated and boosted family members to socialize indoors with a family member who is being treated for cancer? The cancer patient is also vaccinated and boosted.
Dr. O, do you want to weigh in?
Sure. I think that it's important to recognize that when people are immunosuppressed, they may not mount as high an antibody response as people who are not immunosuppressed. So the cancer patient may be somewhat more at risk, but if all of the family members are fully immunized and boosted, and the cancer patient is also immunized and boosted, you're getting as safe as you can get. So I would think that that would be a safe situation. There's always, remote possibilities that people could have breakthrough infection, but that becomes much less likely once people are fully immunized and boosted. You could take further action and wear masks indoors. That might be respectful, and add another layer of mitigation for that individual. And I think too, just talking to your personal provider, they might be able to be more specific for that situation. But you've done the best you can when everyone's fully immunized, fully boosted, and then potentially wearing a mask. I don't know, Dr. Brennan, if you have anything more to add with that. Certainly, individual cases vary, and talking to your personal physician also might be valuable.
I think the situation that was described in the question is about as safe as you can make it for someone who's immunosuppressed. But that person, as you just said, Dr. O, that person may not have responded to the vaccine, so they may still be quite vulnerable despite having been vaccinated and boosted. So, as another measure of protection, you can do home testing. Those rapid antigen tests are not as accurate in asymptomatic individuals as PCR is, but it's another layer of protection.
All right, so our next question from Kevin. Kevin writes, is the vaccine adverse event report system, VAERS, accurate in regards to side effects with the vaccine? If so, how come the risks are always downplayed? Numerous deaths have been reported.
Brian, could you read that one more time for everyone?
Sure. So Kevin writes, is the vaccine adverse event report system known as VAERS accurate in regards to side effects with the vaccine? If so, how come the risks are always downplayed? Numerous deaths have been reported.
I think it's important to understand what VAERS is. VAERS is a system to detect signals, and anything can be put into the system. Because it's put into the system doesn't mean it's a vaccine-related event. There was a period of time in the United States back in the spring when we were administering 3 million doses of vaccine every day. That's twice the size of the population of Philadelphia. So just think about that. If you administered 3 million doses of vaccine, or just on a common day without administering vaccine, how many people in the city of Philadelphia might die? There'd be quite a number. There would, probably be, at least dozens, if not more than 100. So there are events that occur that may not be related, but VAERS is intended to detect signals. So you can put in a death, and if deaths start to accumulate, then they can be investigated and see whether there really is some plausible cause, or perhaps the patient had terminal cancer, or the patient had advanced heart failure, or something like that. That's an alternative explanation. So it's not a system that by virtue of it being in there, it determines that it's actually a side effect. So I wouldn't say they're downplayed. I would say they're cautiously interpreted.
All right, so our next question, Todd, actually it's Martha from Havertown, is asking about the treatment of COVID and specifically about monoclonal antibody treatment and where to get it in Delaware County.
Dr. Eller, Dr. Brennan?
I can take a stab at this. Monoclonal antibody is, certainly a treatment that can be prescribed in the early phases of COVID. Most of the time when people go to the emergency room or if they go to their primary care provider and they meet particular criteria, they may be recommended monoclonal antibodies. So what I would recommend if you have a primary care provider and you're testing positive for COVID and you think you're at risk for severe disease, you should be in contact with your physician as quickly as possible. There is a window of time that monoclonal antibody works best, and you can get it through your primary care provider, or that person can refer you on. If you ended up at an emergency room, they would evaluate you as well and test, and potentially you could be treated with monoclonal antibody through the emergency room. But there is a window of time that it works best, and primary care providers can help you out with that. So I would make that call if you test positive and you think you're at risk for severe disease.
It's oftentimes administered through hospitals. Sometimes emergency departments or their observation units will administer it, but I agree with Dr. O on working through your primary care physician.
And if I may add, from the consumer's point of view, sometimes when some things happen and we need to be alert as we take our family, friends to the hospital, we need to also be aware that sometimes we need to inquire about those type of treatments. If they're not mentioned to you for any reason, feel free to inquire, to ask, what about these type of treatment? Can I be eligible? Will that make a difference? So sometimes that extra effort is needed to move the process along sometimes. So I just wanted to share that with you.
Okay, so we have exhausted our live questions. However, we do have some additional questions based on input from residents through our Delaware County Wellness line and at the Wellness Center in Yaden. So the first question I'll ask is, one question is, I already had COVID, so I thought I was protected from getting it again. Do I still need to be vaccinated if I've already had COVID?
It's very clear that reinfections occur. There's no question about that. Natural immunity may not be sustained as long as vaccine-induced immunity. And if you've had COVID and you take the shot, you may have more potent immunity than someone who just gets COVID or just takes the shot. So you have a combination of both natural and vaccine-induced immunity. So it's very clear that reinfection occurs, and I would strongly encourage it. It's recommended.
I can add something to that. I would also add that COVID infections vary. So some people have mild COVID infections and some people have very severe COVID infections. And it seems as if the antibody response that you get with your natural infection can be really variable. So if you had a mild infection, you might not have mounted too much in the way of antibody. And remember, if you had the Alpha variant, you might not be as protected against Delta, et cetera. So I agree absolutely with what Dr. Brennan said, that vaccine antibody is much more sustained and certainly if you've had COVID, you should still get a vaccine and boosted. So absolutely.
So our next question would be, some residents who have visited our wellness center in Yeadon have indicated that they were hesitant to get vaccinated, concerned about getting temporarily sick and missing work. Is there anything someone can do to minimize potential side effects from the vaccine?
I can try that. I think the really important thing to appreciate is that the side effects from the vaccine are minimal, and getting COVID disease is, so much more of an issue. So if people are worried about feeling sick from vaccine, they really should turn their worry to feeling sick from COVID disease. The side effects from the vaccine are really limited, mild. They last, 1 or 2 days. And I think that people really should appreciate that the benefits of a vaccine, far outweigh the risks, and that disease is certainly something that's going to be much more problematic than the vaccine. So they should really be more concerned about COVID disease rather than the mild side effects from vaccine.
Dr. Barnett gave a very eloquent discussion of the difference between COVID and the vaccine, which I really appreciated. You can also take Tylenol or Advil too.
That's what I was going to say. Just take a Tylenol before you go in. Take a Tylenol a little bit later, and you'll be fine. The other thing, make sure that you get your vaccine. If you're off on Saturday, get the vaccine on Friday, and give yourself a little bit of time so that you can rest in. And so if you go to vaccines.gov, you can find a place to get your vaccine and a date and time that fits you. And so that's what I would encourage you to do. Find a time that's right where you have a day afterwards. So even if you have to get it Saturday so that you can have off Sunday, do that. But it's so much easier to prevent getting reinfected.
Okay, another question. If my child is at low risk for severe effects from COVID, why should I get them vaccinated?
I'll take that question. It would seem that COVID is generally mild in children. So the risk of getting into trouble with COVID disease is relatively low. The reason we really want to get the 28 million children in this new age group 5 to 11 vaccinated is not only to protect the individual child, because it will, and because there are consequences often that can be eliminated in the child, but also to protect vulnerable family members, to just dampen the spread of the virus. Because as Dr. Brennan alluded, the more this virus has a chance to spread, the more potential it has a chance to mutate. So if we really are minimizing the numbers of people that can harbor the virus, we're minimizing the opportunity for this virus to spread and mutate. So we do it for the individual child, for the extended family, for vulnerable family members, for the school community, and then just at large, when you look at the bigger picture, we do it so that this virus isn't given opportunity to spread and mutate within our population.
Thank you, Dr. F. And just wanted to throw a reminder out there for anybody who joined us late that if you have any questions for the panelists, please feel free, if you're on Zoom, to add your question into the Q&A section, or if you're on the phone, just push 0 to send in a question. Thank you. Ryan?
Okay, another question. Are there any new insights or new data about COVID-19 immunizations during pregnancy?
Not from publicly available data sets for us right now. Maybe in the future, when we have access to state health department data files, we might be able to definitely get that information, because they do keep information like pregnancy, demographic, race, ethnicity, age, locations at the state level. Right now, we don't have access to that data. Hopefully, we will get access to that data next month.
There have been publications on the outcomes of pregnancy and reports from CDC, and the evidence is clear that there's a greater risk of adverse outcomes in pregnancy. Mothers get sicker; they require ICU hospitalization more often and ventilatory support. Fetal outcomes are worse. There are no anomalies reported to my knowledge, but premature birth is higher, and loss of the pregnancy. So it's a significant issue, and the recommendations of all the professional obstetrical societies now is to take the vaccine during pregnancy.
I would go one further on that one.
Go ahead.
Yeah, so what I would say is that vaccine is recommended before, during pregnancy, with breastfeeding. There's data, as Dr. Brennan suggests, that pregnant women have, with COVID infection, are at high risk for severe disease, and this impacts the mother, the baby. So across the board, it's recommended if you're planning on becoming pregnant, if you are pregnant, or if you are breastfeeding. In all three of those scenarios, it's recommended to get the vaccine.
And actually, in the studies that have been done, Dr. Rowe, I'm certain of this, the rate of miscarriage and pregnancy was actually lower in vaccinated women. Not that that was the cause of the lower miscarriage rate necessarily, but it was at least no different. A relatively high number, as many as 15% of pregnancies end in pregnancy loss, but vaccine didn't impact that.
And an added benefit is if you get the vaccine during pregnancy, there is antibody that crosses over to the baby to protect the baby. And also, if you're breastfeeding and have had the vaccine, you are conferring antibody through breast milk. So this is actually protective for the baby.
All right, we'll move on to the next question. We do have another question that came in through our phone participants. Kyle from Chester writes, I only get seasonal allergies. Why should I get either a COVID or flu vaccine if I am healthy?
Well, I think the best reason is to stay healthy. Both of those illnesses, influenza is no fun. Believe me, it is no fun. It's not as lethal as COVID-19, but 40 to 60,000 people die every year of influenza. The benefits of the vaccine are very clear in terms of preventing infection, maintaining health, enabling people to continue to work, preventing school absences, all of that. Influenza vaccine is an important preventive measure, and I recommend everybody get one every year. COVID is a much more serious infection, and the worst consequences, of course, are dying of the infection. There are lots of other really terrible consequences, including the inflammatory responses that lead to strokes and heart attacks and blood clots. Long COVID, Dr. Barnett can describe those to you very well. There's a phenomenon in women of hair loss. A very high percentage of women lose hair. They develop significant hair loss for 3 or 4 months, and then it takes a while for it to grow back. Sometimes it doesn't fully return. That's relatively minor compared to the cognitive impairment that can occur or the long-term pulmonary effects. We've had patients at Penn that have been sent to us to have lung transplants after COVID. Their lungs were so severely damaged that the only way that they would ever be able to recover and go back to a normal life was to have a lung transplant. We have transplanted patients. So there are very good reasons for both diseases to be vaccinated.
I'll tell you, I'm a 6 mile a day runner. I've been running since I was 10 years old. I am extremely healthy, and COVID knocked me out. And if you think you can run, you really can't, unfortunately. It's not just, unhealthy people. This virus acts in a way that we're not used to. Those who are used to studying flu viruses, we've dealt with H1N1, we've dealt with avian, we've dealt with swine flu, we've dealt with all of these. But 800,000 people, it's difficult to kind of turn away from that. Think about that, folks. That's like the state of Montana that has died. This is not something to be taken lightly. And so you are healthy now. That can be a temporary situation. We want to make sure that you continue to be healthy by encouraging you to get the vaccine.
Also, if I may add, viruses affect individuals in different ways. Some viruses will infect the individual and create very complicated health problems. Other individuals, after being infected, nothing happened to them. So you don't really know. We don't have a test that we can administer, a quick test to find out who will react in a very, very different way, in a very complicated way. We don't have that type of test. So the best thing that we can do is protect ourselves, because you don't know if you will react in a very minor way or a very complicated way. So it's better to be sure, and the vaccine provides that. It's like insurance. So what you're healthy, you want to stay healthy, please consider vaccinating. And of course, following social distancing, masking, and so forth.
Thank you all for your responses. Just one more time, I want to plug for those of you listening in that if you are on Zoom, please submit any questions on our Q&A section. And if you are on the phone, please just hit 0 and you can submit your questions there.
Okay, so we have a few more questions if we don't receive anything else live. The first question, are there any supplements that can help reduce the risk of infection with COVID-19? Examples, methyl B12, vitamin C, vitamin D3, zinc, and melatonin.
I'll start with something that, and Dr. Brennan, if you can add, I think early in the pandemic, before there was vaccine, there was a lot of interest in supplements to lessen COVID disease. And lots of different things were mentioned, such as zinc and vitamin D. And, all of these things are what we use to boost our immune system. So we know that, having sort of a healthy complement of vitamins and minerals makes your immune system work better. But I think that once the vaccine became available, people recognized that not only is it important to be healthy and have a healthy diet, but the vaccine was going to be ultimately what would protect you. And Dr. Brennan, I would be interested in having you weigh in on this as well.
I'm not aware of any solid data demonstrating benefit. On the other hand, as you point out, these are things that we regularly take for a variety of purposes, beneficial purposes. And so, I wouldn't discourage it. However, I would not encourage taking them instead of monoclonal antibodies or presenting to the emergency department and getting steroids or remdesivir or perhaps the antiviral drugs manufactured by Merck and Pfizer that will be available soon.
Okay, one more question, actually two more questions. So this is a question based on many of the comments we receive on social media regarding myocarditis, blood clots, heart attacks. Many people just want to know, I know you've addressed this already, but is there any truth to this? What are the dangers of such side effects, especially among younger individuals?
Well, what the FDA has indicated in its reviews is that there have been reports that have emerged from the surveillance of myocarditis occurring particularly in younger individuals, but they are rare occurrences, and the benefits of the vaccine vastly outweigh the risk of developing myocarditis or blood clots. There are some criteria established around or recommendations, I should say. They don't preclude women of certain ages from getting the Johnson & Johnson vaccine, for example, where the blood clots were reported. But there is guidance about that, and the opportunity to take other vaccines is certainly there.
I think the important thing for the pediatric age group and adults as well, I think the statistics are that it's about 6 times more likely that you would develop myocarditis from COVID disease than from the vaccine. So the important piece is that myocarditis is caused by a lot of viruses, and it is more common in late adolescence and adulthood than it is in childhood. So we don't expect myocarditis from vaccine in early childhood, but really remember that the risk of myocarditis is much greater if you contract COVID disease, probably 6 times greater than if you get the vaccine. And it's a very low risk.
Good point.
Okay, we do have another question that came in through Zoom. I don't know if we have the answer to this, so I'll put it out there. Kim writes, are there any free rapid testing locations in Delaware County?
Yeah, we are doing PCR testing in Delaware County. We have 2 sites, one at the Delaware County Wellness Center in Yeadon, and our other site is the Keystone First Wellness Center in Chester. Both of those sites do PCR testing with a turnaround within about 2 to 3 days. So we are not doing rapid testing at those sites.
I would like to add that there is rapid testing at Sonic, which is the location that is at the Springfield Mall. They're in the parking lot on the Baltimore side of the mall.
Thank you.
Okay, so we have no additional live questions. So our final question for the panelists tonight, are there any county-run pediatric vaccine clinics coming up?
Yes, in fact, tomorrow, Thursday, at the Keystone First Wellness Center in Chester, we have a vaccine clinic that will run from 2 p.m. to 6 p.m. And there'll be another clinic, I think, on Saturday as well, both in Yaden and in Chester, where pediatric vaccine will be available. We are incorporating pediatric vaccination in all of our clinics at this time.
Well, thank you, everyone. Those were some great questions and very thought out and detailed answers from the team of panelists. I hope this was helpful to not only those who submitted the questions, but also to others who may have had similar questions. The more knowledge we have, the better we can make informed decisions about the health and safety of ourselves, our loved ones, and for our community. And I'd like to thank our panelists who participated tonight and the residents who took the time to join the presentation. Panelists, I'd like to invite you to take a minute or two to make a closing statement. And we'll begin with Dr. Victor Elusram.
Thank you very much. Wonderful opportunity. What I would say is consider it, think about it. Try to protect yourself. Try to protect your family, your friends, your community. We will be able to work together and solve this problem that has taken so many lives and so many of our resources and liberties. That's what I will encourage people to consider: vaccination, using masks, social distancing, and sanitizing.
Thanks,
Dr. O.
Yeah, thank you everybody for your time and attention. And it has been really a pleasure to be with this great group of panelists. What I would recommend is if people still have concerns and questions, please just reach out to your trusted family physician, pharmacist, have conversations, get your questions answered. Certainly we are available at the Delaware County Wellness Center. We have a wellness line. If you have questions and want to be connected, feel free to give us a call. But ask questions and get your information from trusted sources and not social media platforms. And hopefully if we can get more and more people immunized, we'll just move the needle closer to the end of this pandemic. So thank you everyone for participating.
Thank you, Dr. O. Dr. Brennan?
Thank you, Dr. Taylor. Thanks for inviting me to be on this. I've enjoyed listening to all of the panelists and appreciated their perspectives. What I would say in closing is that we're moving into the most difficult part of the year. This virus appears to have seasonal qualities, whether they're intrinsic properties of the virus or whether it's just our congregation indoors during the cold weather months. We're seeing another surge that we hope will not be as bad as the one we saw last year. But the good news is that the worst consequences of this virus are preventable and you can protect yourself. So I hope you will take advantage of that and mask where appropriate indoors and take advantage of the vaccines that are widely available to you now.
Thank you, Dr. Brennan. And Dr. Barnett?
Thank you so much, Dr. Taylor. Thank you to all of the panelists for this opportunity to just sit and listen and have a conversation about this topic that seems to have consumed all of our lives. And in the city of Chester, we've been able to move the needle. We've doubled the number of vaccinations from 27% to almost 54% today in terms of the number of people in the city of Chester who have gotten at least one shot. And that was done with just an all hands on deck effort. The Bureau of Health, organizations, faith-based community, everyone working together, talking to people, doing everything that they can do to get loved ones, friends, coworkers vaccinated. And so what I just encourage you to do is if you run across a person who has questions or seems hesitant, hey, just listen to what they have to say and then point them in the right direction. We've got good information on all of our websites. Delaware County has a fantastic website. We've got chestercovidinfo.org where you can get information about where to answer your questions. And so I encourage you to seek out those sources and stay off social media.
Thank you, Dr. Barnett. And before we end the town hall, I'd like to remind residents about Delaware County's Wellness Line. The Wellness Line was created to assist residents with COVID-19 related questions and concerns, as well as other public health related topics. The Delaware County Wellness Team can assist residents in locating convenient COVID-19 vaccination sites, locating COVID-19 testing sites, add homebound residents to the homebound roster for an at-home on-site vaccination, answer any general questions that you may have about COVID-19 testing, vaccinations, and booster shots, answer general questions about public health related matters, and also help residents locate public health resources. Now, the Delaware County Wellness Line is open Monday through Friday from 8:30 a.m. to 4:30 p.m. And you can call or email the Wellness Line at 484-276-2100 or email at delco.wellness@co.delaware.pa.us. Thank you again for taking the time to participate and continuing to do your part to keep Delco safe and Delco strong. Thank you all and have a great evening.